Now I am going to discuss about scapula or shoulder blade. So scapula or shoulder blade, it's a large flattened triangular shape bone. Where it is located? It's located into the posterior and upper aspect of the thorax. And you can see here it is extending from second ribs relation till the seventh ribs. Now, what are the presenting parts of scapula? So, there are some presenting parts. On behalf of that, we have to describe. First, it does have head, then neck, and then body. When we will see head, another name is called glenoid cavity. It is covered by a rim of fibrocartilage, and name of that is called glenoidal labrum. And externally they will be covered also by capsule. And the head will be articulate with head of the humerus and forming shoulder joint. And we know shoulder joint, it's a ball and socket variety of synovial joint. Now come for neck. In scapula there are two neck. One we are saying it is called anatomical neck. Another one we are saying it is called surgical neck. Anatomical neck just after the head's glenoidal labrum surrounding, and it will be keep attachment of capsule. Surgical neck, it will be related with nerve and artery. I will show you the relation later. Now body. Body related there are some point. Body contain process. Body contain angles. Body contain borders. Body contain surface. Then there will be notch also present. Process are 3 in number, angle are 3 in number, border also 3 in number, surface are 2 and notches are 2. So, these are the information related with the presenting parts. Let us go to see the image. On screen, now you can see the scapula to view. This is the ventral and this showing dorsal. So, on ventral view, you can see the large body and this is the head. This is the head, or we can say glenoid cavity. Surrounding the head, the area margins is covered by the capsules. This is called anatomical neck. And just after the coracoid process, this section I will say it is called surgical neck. Then the remaining section is body. As I said, body have process, borders, angle, surface and notch. Let's see. There are 3 border. On the dorsal view you can see this is the superior border, this is the medial border and the thickest one is the lateral border. So, 3 border. Then it has 3 angle, the superior angle, this is the inferior angle and the glenoid cavity area which is truncated, we can say this is called lateral angle. So, 3 border, 3 angle. Then we said it has 3 process. The dorsal area, we will see it has a process. Name of this process is called spinous process. So, the dorsal area by the spinous process, it is dividable. Surface descriptions time I will say So, this is the spinous process. It will be continued laterally, a large elongated process. We will see it is called acromion process. And anteriorly very small one, big like projection. This is the coracoid process. So, how many process we got? 3. Spinous process, acromion process and coracoid process. Now, surface. As I said, the spinous process on the dorsal area, actually the surface here what you see, this whole section I am saying, this is called dorsal surface. So, with the help of the spinous process, the dorsal surface is divided into 2. Above the spinous process, supraspinous fossa, below the spinous process, infraspinous fossa. This is the dorsal surface. And on the ventral view what you are seeing, this is the ventral surface. Now, as I said, there are 2 notch also. One notch is when the superior border is heading toward the glenoidal area, there is a notch. Name of this notch is called suprascapular notch. And another notch which is making connection between the glenoid cavity and spine, the supra and infra. Name of this is called spinoglenoidal notch. Actually, the suprascapular notch and this spinoglenoidal notch, if we make an encircle, that will be the surgical neck. Now, we will be discussing about the attachment and relation. So, first as I said, you try to remember this is the superior border. The superior border, when it is heading toward the glenoid cavity, there is a notch. And here you can see the notch is converted into a tunnel by the transverse scapular ligament, and some structures are traveling through here. One is called suprascapular artery, another one is called suprascapular nerve. So, the artery and nerve is coming under the tunnel and artery is coming above the tunnel. So, they are relation with the suprascapular notch, and later they are coming along with the spinoglenoidal notch also. So, surgically if the area is get injured means there will be injury of the suprascapular artery and suprascapular nerve. Another relation is on the medial border of the scapula. You can see medial border of the scapula have relation of dorsal scapular nerve, transverse cervical artery and spinal accessory nerve. So, medial border is related with 2 nerve and 1 artery, and suprascapular notch and spinoglenoidal notch, they are related with 1 artery and 1 nerve, that is suprascapular nerve and suprascapular artery. Now on screen you can see the dorsal surface of the scapula and there are arterial anastomosis. Here, before starting the scapular arterial anastomosis, we have to know about subclavian artery and its branches and axillary artery and its branches. Then the anastomotic artery remembering will be little easy. So, let us start. First of all, how many subclavian artery does we have? We have 2 subclavian artery, one on the right side. So, right subclavian and one on the left side, left subclavian. So, right subclavian artery, it is coming from brachiocephalic trunk, and the left subclavian artery is directly, it is a branch from arch of aorta. Okay. Now, the subclavian artery, it will be continue up to the outer border of first rib. Then the subclavian artery will be continue as an axillary artery. So, subclavian artery extended up to outer border of first rib. Then its continuation will be axillary artery. So, if we see the first ribs, which is attached with the sternum, in one side I am drawing, the artery started to emerge and it will be like this coming. Up to this much we will say it is called subclavian artery. Then onwards it will be axillary artery. Okay. Now this subclavian artery is subdivisible into three parts by a muscles. Name of that muscle is called scalenus anterior. So by scalenus anterior muscles, the artery is divided into three parts. First part, second part and third part. So there is a muscles which is spreading like this way and dividing the whole artery into three. First, under the scalenus, second, and lateral to scalenus, third part. Okay. So each part have some branches. Let's try to remember about the branches. There is a mnemonic for remembering the branches, that is vitamin C and D. So first V. V for vertebral artery. I for internal thoracic artery. T for thyrocervical trunk. Then C for costocervical trunk, and D for dorsal scapular artery. So these are the different branches. Now among first three, they are coming from first part. Then the C, that means the middle one, it is coming from second part, and from third part there is only one branch. So this is all about the subclavian artery related information. As I said, after the subclavian artery, from the outer border of the first ribs, it will be continue as an axillary artery. So this is blue color what I mentioned, it should be the axillary artery. Again, axillary artery with a muscles, it is divided again into three parts. What is the name of this muscle? Pectoralis minor. Pectoralis minor. And what was the name of this muscle? Scalenus anterior. So pectoralis minor. With the pectoralis minor, as it is divided into three parts, medial to the pectoralis minor first part, behind the pectoralis minor will be the second part, and lateral to the pectoralis minor will be the third part. So axillary artery is a continuation of which artery? Subclavian artery. Axillary artery will be continued till the lower border of teres major muscle. After that it will be continued as a brachial artery. So up to the extension of the pectoralis, up to the extension of teres major muscles, it called, the blue color what I mentioned, it called the axillary artery. Now let's start to discuss about the axillary artery branches. So axillary artery, as we said, it is also by the help of muscles divided into three parts, first part, second part and third part. Here also there is a mnemonic for remembering the branches of the axillary artery. Save the lion and protect species. So here we will be taking one. S. S for superior thoracic artery. Then T. T for thoracoacromial artery. Then L. L for lateral thoracic artery. Then A. A for anterior circumflex humeral artery. P. P for posterior circumflex humeral artery. And last one is S. S for subscapular artery. Now here, as I said, there are three parts. So who will be belong for what? S, it is for first part, T and L, it's for second part, and last three will be for third part. That means from the first part only one branch, from second part two branch, and from third part three branch are coming. That's all about the axillary artery. Now this name you have to memorize, then only you can understand when we are going to demonstrate the scapular anastomosis. Let's see in scapular anastomosis what are the arteries coming. So here you can see the subclavian artery, one branch is thyrocervical trunk. From thyrocervical trunk, two branches are here we have to mention. One is the deep branch of transverse cervical artery. Another one is suprascapular artery. The suprascapular artery, through the suprascapular notch and the spinoglomerular notch, it reaching into the body of the scapula infraspinous fossa. And the deep branch of the transverse cervical artery, as we mentioned before, along the medial border it is running. So from here one branch is coming also into the infraspinous fossa of the body of the scapula. So they are actually coming from subclavian artery. Later on we can see from axillary artery there is a branch, name of that is called subscapular artery. From subscapular artery one branch is circumflex scapular artery, which is also reaching into the body of the scapula infraspinous fossa. So here there is an anastomosis. Anastomosis between whom? Branch of subclavian artery and axillary artery. Which part? I guess you can now correlate. Similar, there is one more anastomosis on the acromion process. One branch is coming from suprascapular artery. We are saying it is called acromial branch of suprascapular artery. One branch is coming from thoracoacromial artery, and name of that is called acromial branch of thoracoacromial artery. Then the last branch is coming from posterior circumflex humeral artery. It is also acromial branch. So acromial branch of posterior circumflex humeral artery, and here they are making an anastomosis. So here also we can see the branches are suprascapular artery branch, then acromial branch of thoracoacromial artery branch, and posterior circumflex humeral artery branch. They are making anastomosis. Now muscle attachment. Here actually in screen you can see there are superficial to deep muscles. First, in the superficial you can see there is a large muscle from above, kind of rhomboid shape, that is called trapezius, and deltoid and latissimus dorsi. These are the large flat three muscles. When we remove, we will get some small muscles who are directly related with the scapula. So let's see the muscles related with the scapula. Here also the figure A, it's related with the dorsal surface description, and figure B, it's related with the ventral surface descriptions. On dorsal surface, we will see close to the superior angle there is a muscle, name of that is called levator scapulae. So the superior angle, it contains levator scapulae. Then if we see the inferior angle, it's also related with a muscle, name of that is called latissimus dorsi. And already we know the lateral angle, it is containing glenoid cavity. So three angles have three importance: inferior, there will be arising of latissimus dorsi. Superior, there will be related with the levator scapulae. The superior border, if we see, we will see the superior border is related with a muscle that is called omohyoid. So, omohyoid muscles, inferior belly of omohyoid muscles will be arises from the superior border. If we see the medial border, we will get rhomboideus minor muscles and rhomboideus major muscles. So, along the medial border from superior angle, we can see levator scapulae, then rhomboideus minor, then rhomboideus major. These all muscles are insertion. They are inserting here. If we see the thickest lateral border we will see there is teres minor muscles and there will be teres major muscles. So, teres minor and teres major. Now, we will see relation with the glenoid cavity. There are two muscles. One is here, it is not that much clear, but just remember there are two tubercle, supraglenoid and infraglenoid tubercle. In supraglenoid tubercle, there will be a muscle attachment. Name of that is called long head of biceps. I am writing in shortcut, long head of biceps brachii. In the infraglenoid tubercle, that will be the long head of triceps muscle. Long head of triceps muscle. Here we are asking a question, which one is intracapsular? You have to remember the long head of the biceps will be inside the capsule of shoulder joint, but long head of the triceps is extracapsular. Now, the attachments related with the acromion process. The upper sections of the acromion process have attachment of trapezius. There will be attachment of trapezius, and the inferior or lower sections will be attachments making of deltoid. So, there is deltoid muscles attachment, and above the spine there will be supraspinatus muscles, and below the spine there will be infraspinatus muscles. They also will be origin from here. Now, coracoid process. Coracoid process, it is very important for OSPE. We may ask you the muscles and ligament attachment. Coracoid process, there will be total 3 muscle attachment and 3 ligament attachment. Among 2 will be get origin from here and 1 will be insert. Remember, pectoralis minor muscles will be inserted into the coracoid process of scapula, and in the coracoid process there will be origin of short head of biceps brachii and coracobrachialis. On a screen it is not showing the muscles, so you have to remember origin of short head of the biceps brachii and coracobrachialis. So, total 3 muscle among pectoralis minor will be inserted. 3 ligaments will be also attached into the coracoid process. Coracoacromial, that means coracoid and acromion process will be make a connection with the ligament. Then coracoclavicular, that means coracoid process and the acromial or lateral end of the clavicle attachments ligament, and coracohumeral, coracoid process and the humerus attachments muscle ligament. So, coracoacromial ligament, coracoclavicular ligament and coracohumeral ligament. These are the attachments. Now, scapular movement. On screen you can see there upward rotation and downward rotation of the scapula. The main principal muscles related with the upward rotation will be trapezius, serratus anterior, and downwards rotation will be by the rhomboids, levator scapulae and pectoralis minor. Now, clinical anatomy related with the scapula. Along the inner aspect of the medial border of the scapula, there is one muscle attachment, name of that is called serratus anterior. And serratus anterior muscles is supplied by long thoracic nerve, or we can say nerve to serratus anterior. If the muscle get paralyzed due to injury of the long thoracic nerve, then there will be prominence of the medial border of the scapula. This condition we are saying it is called winging of scapula. Winging of scapula if happened when the patient is trying to push forwards the limb, upper limb, then we can say the prominence is due to the paralysis of serratus anterior muscles and injury of the nerve to serratus anterior or long thoracic nerve. But if the person not trying to push with the upper limb over a wall, but still there is prominence in the medial border of the scapula, we can here assume there is a possibility of injury to trapezius muscle. So, trapezius muscles injury or paralysis, that means the nerve involved in supply of the trapezius is injured, that is accessory spinal nerve. So, when patient try to move with the upper limb on a wall forwards, the medial border get prominent, the muscle paralyzed will be the serratus anterior, the nerve injury possibility will be the long thoracic nerve, that's root bell will be C5, C6 and C7. But if without protruding forward the upper limb, normally also the medial end of the or medial border of the clavicle is prominent, we can think there is a possibility of paralysis of trapezius muscles due to injury of the nerve which is innervating the trapezius, that is the accessory spinal nerve. Now, OSPE questions related with the scapula. Here on the surgical neck of the scapula may be a marking given by the teacher, and they can ask you identify this mark area, what is its relation. So, this is the surgical neck of the scapula. Here will be relation with the suprascapular nerve and suprascapular artery. Suprascapular nerve will be supplied to supraspinous muscle and infraspinous muscle. And we may also give here a pointing, this is the supraglenoid tubercle and this is the infraglenoid tubercle. So supraglenoid tubercle, it will be give origin of long head of biceps, and infraglenoid tubercle will give origin of long head of triceps. Maybe they can ask you which one is intracapsular. We have to remember the long head of biceps is intracapsular. A very important point is the coracoid process. Here also can mark and ask you what are the muscles and ligament attached here. So the ligaments attached will be three: coracoacromial, coracohumeral and coracoclavicular, and two muscles are origin from here, one muscle get inserted here. What are the two muscles? Origin of short head of the biceps and coracobrachialis. Insertion will be the pectoralis minor. Then on body of the scapula also can make anastomosis one questions. They can mark here and can ask you what are the artery here making anastomosis. Answer should be suprascapular artery, circumflex branch of subscapular artery and deep transverse cervical artery. Same one more question also can ask regarding the anastomosis on the acromion process. The artery name will be acromial branch of suprascapular artery, acromial branch of thoracoacromial artery and acromial branch from the posterior circumflex humeral artery.